If you're an assistant of a child with spina bifida and hydrocephalus, this video is for you. I'm Slaveja Kostadinova from Spina Bifida and Hydrocephalus Bulgaria Association.
I am Elena Cholakova from Vision Social Development Agency, where I am in charge of social services in Varna. In the next 10 minutes, we will cover the basics of assistant care as part of inclusion.
However, we invite you to check out the Multi-in Manual for Assistants. There you will find more details on the topics discussed here. The manual is free on the Multi-in Project website. Let's get started. Every child has the right to education in order to develop and improve, to build friendships and to fully prepare for adult life. Children with spina bifida and hydrocephalus have their place in kindergarten and school, along with all other children. Our task as a society is to provide them with a supportive environment so that they can grow and learn calmly and happily. The assistant is one of the key figures in the process of inclusion, as he or she is the most often and closest to the child in daily life. By supporting the child in the school and kindergarten, the assistant not only provides the opportunity to attend educational institutions, but also makes the child's participation in the learning process full and meaningful.
Spina bifida occurs as a result of incomplete closure of the spine and vertebrae. This happens in early pregnancy. There are three most common types and the symptoms may vary. Myomeningocele, called MMC, is the most severe form. Most often, when people talk about spina bifida, they are referring to MMC. Infants have closure surgery shortly after birth. However, this surgery cannot repair the nerves. There is a loss of motor and sensory functions.
90% of children with MMC also have hydrocephalus. It also occurs in children with other diagnoses.
Hydrocephalus is a condition characterized by creation of increased pressure in the cranial cavity due to excessive collection of cerebrospinal fluid. It is treated surgically with the placement of a shunt. The role of the shunt is to mechanically take the excess fluid to the abdominal cavity of circulatory system, where the body reabsorbs it. Many children require multiple shunt revisions. When the shunt is not working properly, various symptoms can occur. The assistant is not a healthcare professional, but can be of a great help recognizing any of these symptoms. Knowing the diagnosis of the child you're supporting is important, but our first tip is to see first the child's personality. Each child is a unique combination of characteristics, strengths, and weaknesses. Therefore, the support they need is so varied.
Most children with spina bifida and hydrocephalus need assistance in the educational process. The scope and intensity depends on child's condition and age, the accessibility and security of the environment, and the services available in the school. Some children may need constant care, while others will need help mainly when moving around or using the toilet.
The assistant can help with a range of activities such as eating, toileting, moving around and positioning. For children with learning difficulties, the assistant can directly support the student, following the instructions of the teachers. No less important is promoting independence and social inclusion.
Up to 90% of children with MMC have urological problems. Many of them manage to achieve social continence and reduce urinary tract infections by using a program of clean intermittent catheterization called CIC. CIC is a technique for draining the bladder at regular intervals using a disposable catheter several times a day. Usually, the assistant performs this procedure in the school, helping younger children who are not yet able to manage on their own. CIC is a technique that is used at home. Just as parents and even 7-8-year-old children master the technique, thus any adult can also learn to apply it. That is a new skill that will expand your qualification. In the appendices of the Multi-in Manual for Assistants, You will find some basic tips for the successful application of this method at school and the main steps in catheterization for girls and boys described in detail. The steps contain illustrations provided by B. Brown Medical. Parents will surely give you many valuable tips. Talk to them about anything that is bothering you.
Wheelchairs, scooters, crutches, canes, orthoses, walkers. Spatial aids radically change the life of children with motor disabilities. They make them more mobile and independent. For most children with spina bifida and hydrocephalus, spatial aids are an integral part of life. It is important for the assistant to be familiar with the aids used by the child, including their purpose, benefits, use, placement and removal, how to assemble and disassemble them during transportation. In the assistant manual, we share tips on the correct use of basic special aids. The wheelchair is one of them. Children spend much of their daily lives in wheelchairs, and poor positioning can lead to serious consequences.
Take the time to study how the child typically uses the aids. Is he active in the wheelchair? How stable is she with the crutches? Can she climb curbs with the walker? It is important to know what the child can do independently and when he or she needs help. Encourage the child to do all she or he can, even if it could take longer. In children with hydrocephalus, there is always a risk of complications associated with shunt malfunctioning. The symptoms of shunt problems may vary. Some symptoms develop more slowly and are chronic. In these cases, the assistant should alert the parents and the child's family doctor. Other symptoms require immediate consultations with neurosurgeon or neurologist. It is essential that adults are well aware of the symptoms of shunt malfunctioning and know when to consult the child's doctor.
Shunt problems are one of the risks that children with spina bifida and hydrocephalus may face. Emergencies are by no means a daily occurrence, but it is important for the assistant to know the most common risks and symptoms and how to react. The assistance is focused mainly on prevention and timely signaling in order to avoid or reduce the risk.
In the manual, you will find useful tips for avoiding risks. You will read how to avoid accidents related to the unsafe architectural environment and improper use of aids, how to help children protect themselves from urological infections, skin infections, freezing, and burning.
However, we must emphasize that the assistant's efforts could not compensate for the commitment of the other parties. Aware of the importance of social contacts for a child's development, we encourage proactivity and different methods of work that would acquaint the circle around the child with his or her strengths and abilities. It is good to be prepared to answer the questions that sometimes other children may ask you. Discuss the issues with the family and the teacher on a regular basis. The topic is not taboo, and when presented in an appropriate way, it can only help other students understand. Lack of information is sometimes more dangerous.
At the same time, there are children who do not need help with social communication, especially with entering puberty. The constant presence of an adult in the company of peers can begin to embarrass and irritate them. Encourage the natural desire for independence and try to help only where the child really needs support.
Some children with spina bifida and hydrocephalus cope with the learning process on their own. For others, however, support from an assistant during classes is essential. The good cooperation between the assistant and the teaching staff is of great importance. Any support the assistant provides in the learning process should be pre-synchronized with the teacher. Whenever possible, the teacher should share the learning plan so that they can work together to adopt the information. You need to coordinate in advance with the teacher on how you will be introduced to the students, as well as how they will address you. Your place in the room should also be determined from the beginning, depending on the support that the child needs. This should be clarified in advance with the teacher and parents.
All participants in the child's life must understand the role of his or her autonomy and its importance for a child's future life. This is probably one of the most difficult roles of the assistant, to support the child and to stand at the same time a step aside in order to let him or her learn, build friendships, and even make mistakes.
And the last tip in this video: don't take anything personally. Children go through different emotional states. Sometimes this affects relationship with others, and the closest people often take the variety of these emotions on themselves. To be a good assistant, you need to believe in what you do. Be willing to constantly learn new things and to not be afraid to stand behind the child, to protect his or her rights, interests, and feelings.
Our goal is to support your efforts, so finally we again invite you to check out the Multi-in resources. In addition to the assistance manual, you may also find resources for psychologists, special educators, or nurses of interest. Good luck!